morning, everyone. We are now live for our virtual event today. Hello to all the parents, kids, and pediatricians joining us, and welcome to the April 2022 Walk with a Doc Kids Time from the Nevada chapter of the American Academy of Pediatrics, which we call Nevada AAP for short. My name is Leanne McAllister, and I am the Executive Director of the Nevada AAP. For nearly 6 years, the Nevada AAP has been meeting the second Sunday of every month in Las Vegas to talk about a wide range of pediatric health topics and then take a walk together. The Nevada AAP also coordinates a walk for the Reno community. Here in Las Vegas, we used to meet every month for most of the year at the beautiful Springs Preserves, except for June to September. Then we headed up to the amazing Mount Charleston Spring Mountains Visitor Gateway to escape the extreme heat in the Las Vegas Valley. Today is Sunday, April 10th, 2022. And as we are still waiting for a COVID vaccine for children under 5 years of age, we are modeling keeping our distance to protect ourselves and our community from the coronavirus by holding this statewide virtual event. By keeping kids from different childcare and school settings apart, we're slowing the spread of COVID-19 in our community. We absolutely want you to get outside for a walk with your family, but until everyone in your household is up to date on all vaccines, we recommend staying away from crowds. For today's virtual event, we welcome Dr. Terrence McAllister, who is a pediatrician at Desert Valley Pediatrics in Las Vegas and the Secretary Treasurer of the Nevada AAP. Dr. McAllister started his career as an active duty officer in the U.S. Air Force, and for over 20 years has practiced in many wonderful communities across the U.S. As for me, well, I'm just lucky that my kid gets to call him Dad. As Dr. McAllister speaks, I encourage you to use the chat box to ask questions, as Dr. McAllister will take your questions at the end of his talk. Dr. McAllister, we're ready when you are.
Great. Thank you very much for that introduction. So as Ms. DiDomenico stated, I am Dr. Terrence McAllister. I'm a pediatrician at Desert Valley Pediatrics. And a lot of my practice involves providing primary care for children, but I also focus quite a bit on children with autism in my practice. And that's what we're going to talk about today. So autism is a developmental disability that affects a child's communication, social skills, and behaviors. Now, autism has been becoming more common across the country and even across the world. The estimated incidence now is about 1 in every 44 children in the United States will be diagnosed with autism by the time they're 8 years old. And the diagnosis is made about 4 times more commonly in boys than it is in girls. So the incidence of autism is increasing, and the question comes in as to why. And there are a couple of things that go into that. One of them is changing definitions of what autism is. We used to diagnose as separate entities autism disorder, pervasive developmental disorder, and Asperger's syndrome. But now, from a medical standpoint, we group all of those together. Recognition of autism has also increased in schools and among parents, and just as importantly, among pediatricians. The American Academy of Pediatrics now recommends that we screen every child at their 18-month well visit and their 24-month well visit for autism. We know that this early screening is important to recognize kids who have autism so that we can start treatments for them, because the earlier we start treatments for somebody with autism, the better that they are able to improve. So what is autism? So autism, as I said, is a developmental disability that affects a child's social skills, communication skills, and behavior. So we look at those things to make the diagnosis. We look at the communication abilities. So children with autism have difficulties with communication. And this is more than just a speech disorder. This is more than just a speech delay. Children with autism seem to have trouble even understanding the need to communicate at times. This kind of oversimplifies things, but a child with autism has trouble understanding alternative perspectives. What that means is that a child with autism who's thinking something believes that everybody's thinking it. And so it's difficult to understand why you have to tell somebody you're hungry if you think they already know. And this goes beyond spoken words rather, but also to nonverbal communication. Even simple gestures like pointing is very difficult for a child with autism. for a similar reason. A child with autism who's looking at something believes that everybody's looking at it. So pointing to it doesn't really make sense. It'd be like pointing out something to yourself. It doesn't seem necessary. And then we look at social skills, because children with autism have difficulty with social relationships. Now, part of this could be related to the communication delays they have. Children play relatively simple games, but they do need to be able to communicate with their peers a little bit to be able to play with them. And so children with speech delays often will just prefer to play by themselves because it's easier. But for somebody with autism, it goes deeper than that. So children with autism often seem to try to avoid social interactions. They'll stay away from their peers or move away from them if somebody tries to play with them. In some severe cases, they don't even like interacting with their own siblings or their parents. Again, that's not everybody with autism. We do call it autism spectrum disorder. There's a wide spectrum of these behaviors, but all children with autism have some trouble with those social relationships. And then we look at behaviors. Children and adults with autism often get stuck in very rigid and repetitive behaviors. A child with autism often wants to keep the same schedule all the time. So they may have certain rituals they go through at night before they go to bed, and they have to do the same things in the same order every night. And if for some reason they can't do that, if somebody's not home who's part of that ritual, or if they're in a different location, it can make it very difficult for them to be able to fall asleep or follow their other routines during the day. This also affects how children with autism play. They often play in ways that are very atypical. So a child with autism may play with a toy car, but they're more likely to just turn it upside down and spin the wheels to watch it spin rather than pretending that it's a car. Or sometimes they'll just line their toys up or drop things to listen to them fall. Children with autism are much less likely to engage in pretend play, where they'll take an action figure and put it in the car and make it drive around, or where they themselves will pretend to be an animal or a dinosaur. Those types of play are very atypical to see in a child with autism. So those are the signs that we look for. The way the diagnosis of autism is made is actually through a collaboration between the doctor and the parents, really. I mean, the parent is an expert on their child. Parents know how their child behave, and then a physician is an expert in autism. And so we collaborate in order to find out if a child's behaviors fit the definition of what autism is. Now, it's important to make the diagnosis of autism and important to make it early when you can, because there are interventions, there are treatments that we can implement for children in order to help them improve with some of these communication skills and social skills. And we do know that children with autism can be very resilient, and with the right kind of interventions, they can progress in their development, and they can progress to the point where they can interact in a more typical way with their peers. So children with autism often go to the same classrooms as everybody else and progress through school the same way as everybody else. They may always need a little extra help with communication skills and with social skills, but they can lead very productive lives through school and even beyond school. And so that's why it's important to make this diagnosis early for children, so we can get them the right treatment that they need, the right interventions, in order to allow them to progress and develop through their lives. So that's my very brief overview. Are there any questions?
Yes, thank you so much for that talk. I do have some parents with some questions. The first question is, a parent wants to know, can you talk a little bit about what causes autism?
Yeah, that's a good question and a very difficult one. It basically boils down to, we don't know. So autism is a diagnosis, as I said, that's made based on a child's behaviors. And so there are a lot of different behaviors, there are a lot of different pathways to get to those behaviors. So there probably are several different things that cause autism. We do frequently do some blood work, some testing in children with autism, looking for certain genetic disorders. And sometimes we find them and sometimes we don't. So that's not the same thing that causes autism in every child that has it. So we're still working to understand it better. There's still a lot of research going on to understand that. But right now, we don't know exactly what causes it. And so we look more at the outcome, at the function of children with autism and what we can do to help them.
And what is the role of a parent or a caregiver to help an autistic teen get ready for adulthood?
Yeah, that's a good question as well. So certainly, as children go through developmental stages, there's different things that have to be that have to be mastered for any child. So any child going from adolescence to adulthood has to learn how to be more independent and to function on their own. And the same is true for a child with autism. I think the best thing you can do is to find a community of peers for a child who are going through similar experiences. There are some wonderful local groups. There's one called FEAT, Families for Effective Autism Treatment, which is a local Las Vegas group that provides support groups and peer groups for children going through autism at all different ages. There's also organizations like Sports Social, which provides both a physical activities for children with autism, but also through those physical activities helps them build the social skills that they need. So I think that's the most important thing, is finding a community, finding a group of peers that are going through similar experiences.
That's great. And we had one parent put in a question that I'm not sure I understand, but I'll read it to you. Can a diagnosis of moderate level 2 go to a mild level of autism?
Okay, yeah, that's a good question. So when we make the diagnosis, as I said earlier, we make it based on behaviors that children are exhibiting. And then from a medical standpoint, we can stratify that decision to mild, moderate, and severe based on, really it's based on how much assistance the child needs in order to master these skills. We do know that with the right kind of treatments, with speech therapy and occupational therapy and something called ABA, or applied behavioral analysis therapy, all of these things help kids to master those skills. And as they master those skills, their severity level very frequently does decrease, because they're gaining that function that they need to be able to develop it in the world. And so, yes, absolutely. The severity level is based on a child's function, and with the right treatments, that can definitely improve over time.
Oh, great. Thanks. I feel like I learned something. Well, thank you so much to Dr. McAllister and to all of you for joining us today for our virtual walk with a doc. Now it's time to walk, and here's how this is going to happen. So we're going to stop the live feed, and I and hopefully all of you are going to go for a walk outside. We welcome you to post photos of yourself walking on the Nevada AAP Twitter feed, which is at AAP Nevada. Please walk for at least 20 minutes, wear sunblock, carry water, stay 6 feet away from other people, and keep a mask on the kids 2 and over not yet vaccinated. Our next English language walk is Sunday, May 8th at 10 a.m. and it will feature Dr. Lily Hadaji, who will be giving a talk on fetal alcohol syndrome. And the following week after that, on Sunday, May 15th at 10 a.m., we have Dr. Jose Cucalcon Calderon, who will give the Spanish language Camine con un doctor on the importance of routine preventative care for kids. All this information is on nevadaaap.org. Thank you, everyone, and have a great walk.